Hi, this is Dana Ranahan of Bodywork Sports Physiotherapy in North Vancouver, and I'm here today with a patient to look at elbow pain. And Elaine here is a competitive tennis player and has been having some trouble with her elbow. So I wanted to talk a little bit about the types of elbow pain we see and how we would look at it. So commonly with the elbow, we would see pain usually on the outside of the elbow is commonly where people would get tennis elbow, or sometimes on the inside of the elbow they'll get pain. Usually they call that golfer's elbow, but they're not necessarily synchronous with those sports. That's just the sort of names that we're used to. So when we would look at this, Elaine's had more pain here with her forehand in tennis. So one of the things we would look at is mobility through her whole shoulder and upper back, as well as her elbow motion. And first off, looking at how her elbow moves and kind of the angle of movement. The elbow is quite a complex joint, so it has combinations of movement that we need to ensure the elbow can move well through its full range of motion. Because if there's some restriction in range of motion, it ends up creating tension. For example, if the elbow is really tight on the outside, it can pull the arm away and create more stress on the inside of the elbow. So for Elaine, we would look at doing these motions, and we've just done some work to help loosen things up for Elaine and determine, one, where is she tight? Where do things not move? And then we would do some other specific palpation to determine where her tender points are and testing some of the muscles. The muscles that are in the forearm generally help to move the wrist and forearm into twisting or wrist movements. So we would do some tests like this to determine where the pain is. And then we would mobilize to help her joint move a little freer and give her some exercises so that she can work on home to maintain it. If you have more questions, check out our website at www.body-works.ca.